What's up, everyone? It's Shahab, and today we're diving deep into something that pretty much all of us have experienced at some point: headaches. That throbbing, aching, sometimes debilitating pain in your head can really throw a wrench in your day, can't it? It's more than just a simple annoyance. For many, it's a recurring issue that impacts quality of life, work, and even our relationships. We often just pop a pill and hope for the best, but what if we could understand them better? What if we could identify the specific type of headache we're dealing with and find more targeted, effective ways to manage them or even prevent them in the first place? Headaches are a common health issue with a variety of causes and remedies. Understanding the type of headache you're experiencing is key to effective treatment. It's not a one-size-fits-all situation. Think of it like this. You wouldn't use a hammer to fix a leaky faucet, right? Similarly, different headaches require different approaches. From the dull pressure of a tension headache to the intense one-sided throb of a migraine, each has its own signature, its own triggers, and its own set of solutions. That's why knowledge is power when it comes to tackling these common pains. In this video, we're going to break down the most common types of headaches, explore their causes, identify their distinct symptoms, and most importantly, discuss effective remedies and lifestyle adjustments that can bring you relief. We'll equip you with the headache hacks you need to know, moving beyond just temporary fixes to a more comprehensive understanding. So grab a glass of water, hydration is key, as we'll discuss later, get comfortable and let's get into it. By the end of this, you'll be better prepared to face that head pain head on. Alright, let's start with the most common culprit, the one most of us are unfortunately all too familiar with, the tension headache. Think of it as that unwelcome guest that shows up when you're stressed, haven't slept well, or have been hunched over your computer for hours. The primary triggers for tension headaches often revolve around our daily habits and stresses. We're talking about psychological stress from work or personal life, prolonged anxiety, muscular tension from poor posture, especially that tech neck from looking down at screens, and even significant eye strain from focusing too intently for too long without breaks. Even things like clenching your jaw or grinding your teeth, often stress-related too, can contribute to this type of head pain. The symptoms of a tension headache are usually described as a dull, aching pain, almost like a constant pressure. Many people say it feels like a tight band is wrapped around their forehead. Or sometimes it can manifest as pressure on the sides and back of the head, or even in the neck and shoulders. Unlike migraines, tension headaches don't usually come with nausea or vomiting, and they typically don't get worse with routine physical activity, though you might not feel much like moving. It's that persistent, nagging ache that can make it hard to concentrate and just get through your day. Identifying these triggers and symptoms is the first step in finding relief and preventing them from becoming a chronic part of your life. Next up, we have migraines, which are often in a league of their own when it comes to headache intensity and complexity. These aren't just bad headaches, they are a neurological condition that can be incredibly disruptive. Migraine triggers can be incredibly varied and personal. For some, it might be hormonal changes, particularly in women around their menstrual cycle. For others, specific foods or drinks can be the culprit. Think aged cheeses, processed meats, chocolate or red wine. Stress, as with tension headaches, is a major player, but so is a disruption in your sleep patterns, whether it's too little sleep or even too much. Bright lights, loud noises, and strong smells can also set off a migraine attack in susceptible individuals. The symptoms of a migraine are typically more severe and distinct than a tension headache. We're often talking about a throbbing or pulsating pain, frequently, though not always, localized to one side of the head, but it doesn't stop there. Nausea and vomiting are very common companions to migraine pain. Extreme sensitivity to light, known as photophobia, and sensitivity to sound, or phonophobia, are also hallmark symptoms, leading many to seek refuge in a dark, quiet room. Some people also experience what's called an aura before or during the headache, which can include visual disturbances like flashing lights, zigzag lines, or even temporary vision loss. Understanding these multifaceted symptoms is crucial for distinguishing migraines from other headache types. Now, let's talk about a less common but incredibly severe type of headache, the cluster headache. These are often described as one of the most painful conditions known to medicine, and for good reason. While the exact cause isn't fully understood, cluster headaches are thought to be related to activity in a part of the brain called the hypothalamus, which plays a role in our biological clock or circadian rhythms. This might explain why these headaches often occur in cyclical patterns or clusters, happening at the same time of day or same time of year for a period, followed by remission. Some research also points to the trigeminal nerve pathway being involved in the intense pain experienced. The symptoms of a cluster headache are excruciating and very specific. Sufferers typically experience an intense, severe burning or piercing pain, usually located in or around one eye or on one side of the head. This pain can be so intense that people often become agitated and restless, unable to sit still. Unlike migraine sufferers who seek quiet darkness, those with cluster headaches might pace the room. On the same side as the pain, you'll often see other distinct symptoms like a red or tearing eye, a droopy eyelid, a runny or stuffy nostril, and facial sweating or flushing. These attacks can occur multiple times a day during a cluster period, which can last for weeks or even months. Chapter 4. Moving on, let's discuss sinus headaches. These are often confused with migraines or tension headaches because the pain can be in similar areas, but the underlying cause is quite different. A true sinus headache is caused by a sinus infection or sinusitis, which leads to inflammation and a buildup of pressure in your sinus cavities, those air-filled spaces behind your forehead, cheekbones, and the bridge of your nose. When these cavities get blocked and fill with fluid, often due to a cold, allergies, or a bacterial infection, the pressure can cause significant discomfort and pain. It's that feeling of your head being full and under pressure. The key symptoms to look for with a sinus headache include a deep and constant pain or pressure in your forehead, around your eyes, across your cheekbones, or in the bridge of your nose. One of the telltale signs is that the pain often worsens when you bend forward or lie down, as this can shift the pressure within the sinuses. You might also experience other sinus-related symptoms like a stuffy or runny nose, sometimes with thick discolored mucus, a feeling of fullness in your ears, facial swelling or tenderness, and possibly even a fever if an infection is present. Differentiating this from a migraine, which can also cause facial pain, often comes down to the presence of these other cold-like or infection-like symptoms. Chapter 5. The self-inflicted ache understanding rebound headaches. This next one is a bit of a tricky situation because it's a headache caused by the very thing you might be using to treat your headaches medication. We're talking about rebound headaches, also known as medication overuse headaches. This can happen when you frequently take pain relief medication for headaches, whether it's over-the-counter options like NSAIDs, acetaminophen, aspirin, or even prescription drugs like triptans or medications containing caffeine or opioids. While these can be effective for occasional headaches, using them too often, typically more than 2 or 3 times a week, or more than 10 to 15 days a month depending on the medication, can backfire. The cycle of a rebound headache is frustrating. You take medication, your headache goes away, but then as the medication wears off, the pain comes back, often prompting you to take another dose. This leads to a pattern where you're experiencing more frequent headaches, often daily or near daily, and they might feel different or more persistent than your original headaches. The very medication that once brought relief now becomes the trigger. Symptoms are typically a persistent, dull headache that's present upon waking and may improve temporarily with medication, only to return. It's a tough cycle to break because your instinct is to treat the pain, but in this case, that's perpetuating the problem. Chapter 6. The thirst signal, recognizing dehydration headaches. Now, let's talk about a very common yet often overlooked cause of headaches: dehydration. Our bodies, and especially our brains, rely heavily on a proper fluid balance to function optimally. When you don't drink enough water or lose too much fluid through sweat, illness, or even just forgetting to hydrate throughout a busy day, your body can enter a state of dehydration. Even mild dehydration can trigger a headache, as your brain tissue can temporarily shrink or contract due to fluid loss, pulling away from the skull and causing pain. It's your body's not-so-subtle way of telling you it needs more fluids, stat. The symptoms of a dehydration headache can vary from mild to quite severe. Often it's described as a generalized head pain, meaning it might not be localized to one specific spot, but felt more diffusely. You might also experience other telltale signs of dehydration alongside the headache, such as a dry or sticky mouth, increased thirst, though sometimes the thirst mechanism can be blunted, decreased urine output or darker yellow urine, fatigue, dizziness, and sometimes even irritability or difficulty concentrating. The good news is that these headaches can often be resolved relatively quickly by rehydrating, but prevention by maintaining consistent fluid intake is always the best strategy. It's a simple fix, but one we often forget in our busy lives. Chapter 7. The Caffeine Conundrum. Navigating withdrawal headaches. Last but certainly not least, let's discuss a headache that many coffee, tea or soda drinkers might experience if they suddenly cut back. The caffeine withdrawal headache. Caffeine is a stimulant and it also has vasoconstrictive properties, meaning it can narrow blood vessels, including those in your brain. If you regularly consume caffeine, your body adapts to its presence. Your blood vessels may become slightly dilated to counteract caffeine's constricting effect and maintain normal blood flow. So, when you abruptly stop or significantly reduce your caffeine intake, these blood vessels can dilate too much, leading to an increase in blood flow and triggering a headache. The primary symptom, of course, is a throbbing headache, which can range from mild to severe and often feels diffuse. This headache typically starts 12 to 24 hours after the last dose of caffeine and can last for several days, though the worst is usually within the first day or two. Alongside the headache, you might also experience other withdrawal symptoms such as fatigue, drowsiness, irritability, difficulty concentrating, nausea, and even muscle aches. It's a real testament to how much our bodies can get used to regular caffeine intake. If you're looking to reduce your caffeine consumption, doing it gradually rather than going cold, turkey can often help minimize or prevent these uncomfortable withdrawal headaches. Outro: taking control, your headache action plan and when to seek help. So there you have it, a deep dive into some of the most common types of headaches, their causes and their symptoms. Understanding what might be triggering your specific head pain is the first powerful step towards finding effective relief and improving your overall well-being. Whether it's recognizing the signs of a tension headache from too much screen time, identifying your personal migraine triggers, or realizing that daily cup of coffee, or lack thereof, is playing a role, knowledge empowers you to make informed decisions about your health. Remember, small changes in lifestyle, hydration, and stress management can often make a big difference. However, it's crucial to know when a headache is more than just a temporary nuisance and might signal something more serious. If you experience sudden, severe headaches, often described as the worst headache of your life, headaches accompanied by fever, a stiff neck, confusion, seizures, weakness, numbness, or difficulty speaking, or headaches that develop after a head injury, you should seek medical help immediately. These can be red flags for conditions that require urgent medical attention. Furthermore, chronic headaches that are increasing in frequency or severity, or those that consistently interfere with your daily life, should also be evaluated by a healthcare professional to rule out underlying causes and develop an appropriate management plan. Don't just suffer in silence. Keep a headache diary, note your symptoms, potential triggers, and what brings relief. This information can be invaluable when you talk to your doctor. I hope this breakdown helps you feel more equipped to understand and manage your headaches. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more health insights. What are your go-to headache remedies? Share them in the comments below. Let's learn from each other. Stay curious, stay informed, and as always, stay happy and healthy.